Parliament. Right now, I'm taking you to the chamber
which has made
where
it
the Minister
difficult.
of Health is addressing the House and briefing them on the dialysis situation at the Kolebu Teaching Hospital.
To thank once again the First Sky Group of companies for this massive philanthropic gesture which has supported Kolebu and patients for the last 6 years. Mr. Speaker, in view of these challenges, Kolebu has accrued a total debt of a little over 4 million Ghana cedis to its partner. Furthermore, it remains a fact that the current charge of 380 cedis for dialysis is insufficient to enable the RDU to generate enough revenue to fulfill its full obligations under the contract with FMC, especially as it does not have a hedged exchange rate per annum regime. This has compromised the ability of the RDU to raise the funds required to pay for consumables procured from FMC promptly. Mr. Speaker, again, due to the high incidence of patients requiring dialysis, the total cost of care keeps rising, adding to the accumulation of debt. Mr. Speaker, it must be noted that currently patients on dialysis are not on the National Health Insurance Scheme. Mr. Speaker, the Kolebu Teaching Hospital, in consultation with the Minister of Health, has initiated discussions with FMC for review of the current contract for more flexible payment options and a more structured supply of consumables to avoid excessive delays and to ensure delivery of the outstanding 45 dialysis machines and auxiliary equipment to boost the service being rendered. Mr. Speaker, in the meantime, the RDU has been opened to the public since Monday, 6 November 2023, to add patients as directed by the ministry. The MOH has since made a request to the Ministry of Finance to settle the total indebtedness of the 4 million Ghana cedis. Made a request to the Ministry of Finance to settle the total indebtedness of the 4 million Ghana cedis. And the good news now is that the Minister for Finance has just approved the disbursement of this 4 million to support our patients in Kolebu. Way forward. To forestall the recurrence of this unfortunate situation, the Ministry, in collaboration with Kolebu and the Minister of Finance, is considering one of the following options: the possible inclusion of dialysis on the National Health Insurance Benefit Package, the granting of subsidies based on proposal received from Kolebu, and the possible review of the tariffs to ensure sustainability of the services. And Mr. Speaker, it may interest you to note that the private health facilities charge between 800 and 1,300 Ghana cedis for just a session of dialysis. The decision on the options enumerated above, Mr. Speaker, will be announced as soon as practicable. Mr. Speaker, as part of our non-communicable diseases roadmap, the Ministry and its agencies will continue to raise awareness for prevention and early detection to reduce renal disease and minimize the burden on the renal units in the health sector. When this is realized, the total cost of care and the need for dialysis will be brought to the barest minimum. Mr. Speaker, government has invested, with the support of Parliament, by approving facilities for us in the construction of a 100-bed ultramodern urology and nephrology center of excellence at the Kolebu Teaching Hospital, which will be commissioned by the end of the first quarter next year, 2024. This is aimed at facilitating the provision of kidney transplantation services, among others. Mr. Speaker, this will further reduce the dialysis burden on the nation and the need for Ghanaians to travel abroad for these services. A local team has been trained to provide these services, transplantation services, at reduced cost, and have already undertaken the first few kidney transplantations successfully in country by our Ghanaian doctors. Mr. Speaker, I believe this is the beginning of the government's vision of making Ghana a hub for medical tourism. Mr. Speaker, I believe there is hope ahead of all of us Ghanaians. I thank you.
Very well. Yes, Honorable
You heard the Health Minister Kwekwajaman Meno briefing Parliament on what government intends to do to deal with the situation at Kolebu Teaching Hospital. We'll definitely bring you more from Parliament.